and welcome to another edition of Trade Talk TV. Today we've got Gareth from PulsePoint in the office. Gareth, thanks for coming in today.
No worries.
Today we're going to talk about the health ecosystem, programmatic ecosystem. Obviously, programmatic now is being adopted as a general sort of way to trade media across different verticals. But what we're seeing increasingly now is the verticalization in programmatic. And one of the more interesting areas it's happening is in health. And Gareth is working with PulsePoint, and they're obviously making a big play in this area. So, Gareth, just give us an overview of the PulsePoint proposition now, and we'll just jump straight into what the health programmatic ecosystem looks like.
Sure. So, we've traditionally been an ad exchange. We've also got a content discovery platform, and we've been able to service the supply and demand side pretty well with those two products. And what we've realised is the need to specialise in a particular vertical, and for us, it's been health. So we've been building our business around solving some of the problems that the health industry might see as challenges when they come into programmatic, things around regulation, data, and things like that. So
health is quite an interesting one in Europe. In the US, obviously, you can advertise anything. Obviously, the US TV is a hilarious thing for advertising sort of the most obscure aimals. But in Europe, there are tight regulations around what you can and can't advertise. So let's talk about this ecosystem, because obviously you have some specialist sites that sort of deal with that go towards the medical professions.
Yeah.
So how do you build something that's like, obviously we've seen Super Awesome do something similar for a heavily regulated area like kids marketing, but this is equally as heavily regulated in Europe, particularly.
Yeah. So there's two, broadly speaking, there's two tranches you can go for, both in the US and in Europe. One is healthcare practitioners, or HCPs is the acronym, and they're basically doctors. And they're, pharmaceutical brands definitely want to talk to doctors because they're the guys who prescribe their products. And there's also patients or consumers. In the US, you can market pharmaceuticals to both. In Europe and the UK, you can only market pharmaceuticals to healthcare practitioners in certain environments. So you couldn't put an advert for a branded drug on a site that you or I can visit. You'd have to put it on a site that is login protected, where you have to be a doctor. So you have to have a registered doctor's number to log into.
So talk about some of these publishers who work in that space and how they might work with your technology. So just sort of give us an overview of how a specific publisher uses the PulsePoint technology to help increase yield and increase revenue on the site.
Yeah, so have a look at what we might do. So imagine we're doing, so for HCP, so healthcare practitioners.
Yeah.
You want to find an audience, and you're going to have some industry filters. Right. And this is where you're going to scrub out your invalid traffic, so all your fraud. You're going to scrub for brand safety. Brand safe. And then you're going to, make sure you're protecting your publishers, because you're going to look for malware and adware and stuff like that. So that's going to get you a pool of inventory you can play in. And that, that's industry style. When you look at health, you need to go a little bit further. So then you've got health specific filters. So, and here you're going to be looking at stuff like, you might want to consider, particularly for HCPs, you're going to whitelist heavily because you only want to be on the sites that have got that content.
Yeah.
You're also going to want health, and this one's really important, health specific. Brand safety filters. And what I mean by that, is, say you're got a wonder drug for some sort of sexually transmitted disease. It's a wonder drug, it's great, you want to get it out there, it's going to change people's lives, and you can legally advertise that in the right place. Pretty much everyone's brand safety filter is going to scrub it because it's going to have words in there that are associated to porn.
Yeah.
So if you try and run that through, if you're a publisher who wants to work with a brand and you've got that content, if you try and run it through traditional pipes, whether it be exchanges or DSPs, it's going to get scrubbed here. So you need to make sure you're working with someone who understands, getting you the right sites where it's legally possible, but also is able to open up stuff that's appropriate while still stopping the stuff that's going to damage the brand. And then what you've got here is you come down to your targeting. And this is really important when we get to Europe, because what you've got here is you want to have your HCP, so that's your audience, and then that needs to be 100% verified in Europe.
So how do you do that? Because obviously, are they logged in sites effectively?
Yeah. So
and it's not so outsiders don't have access to that specific.
Exactly. So, for example, there's a site called doctors.net.
Doctors.net, yeah.
Most people have never heard of it because you're not doctors, but if you're a doctor, it's probably the most popular site in the UK. I think they're bigger than The Economist in terms of like monthly page impressions.
Okay.
I think they've got like 220,000 registered users.
Right.
And they're all doctors who all sign up and use their registered doctor number and go through a vetting process to get in there.
Right.
And then you've got like Haymarket have got some good titles. There's a big company out in Germany called DocCheck. I don't know if you've heard of those guys. They're doing something quite cool where they've created a universal login that works across all gated content.
Okay.
So if you work with like those publishers, they can give you that 100% verified audience. You can also work with some data providers, and you can find doctors HCP, but it's not necessarily as verified.
But would that not open you up to some potential sort of issues? Like, the biggest issue you don't want to be kind of a slap with a massive fine.
The big one for that is what we do is you do off-duty targeting. And off-duty targeting might be you want to show it's disease awareness. You're not showing them any sort of pharmaceutical product.
Right.
You're kind of there may be a disease quite prevalent, or something a really pleasant side effect that we found. Is doctors tend to be reasonably wealthy people,
right? And
there's a lot of traditional brands that work with some of the agencies we're talking to outside of the pharma side. They're like, I'd love to target people that earn over 150k a year for Porsche or Burberry.
So the question I've asked you though is the CPMs for these sites is quite high. Why would they want to use programmatic when the traditional way of IO based buying was probably more sort of easy to do? What's the rationale behind it?
I think the main rationale is it's not an if, it's a when. And you think about the pharmaceutical industry. When you think about like drug development, R&D, it's one of the most cutting edge industries in the world. But they've been a little bit slow when it comes to the marketing side. And at PulsePoint, we're firm believers that everything that can go programmatic will go programmatic, and not just advertising. You think like driverless cars, automated ticket machines in the tube, things like that. So at some point, they're going to want to automate this. And when we're talking to the HCP publishers out there, when we're talking to some of the specialist agencies who work with pharma brands, they all know programmatic is coming, and they all want to dip their toe in the water. But the biggest blocker so far has been there hasn't been anyone that is specialised in this that will understand the health specific stuff, that will invest in the legal side, because there is a whole myriad of legislation. And it, broadly speaking, for Western Europe, it's similar, but it's not the same.
Right.
You might be able to target a pharmaceutical branded advert to a doctor in the UK and a doctor in Switzerland, but what you can say to that doctor might be different.
Yeah.
So they've been waiting for someone who can understand that market, invest the time and the resource to be able to do that in a way where the brand can go, okay, I'm covered, I'm not going to get into any trouble for this. And also, to your point about the CPMs, the publisher knows they're going to get the real value. Because if you've got that audience and you've got that site, you're not going to jump in with a player who can give you, an average of $3 to $5, which would be pretty good for, programmatic without any targeting elsewhere. But when you're thinking, well, I've got a gate, it's secure, it's gated, it's doctors, I might want £30 to £100 for that.
Yeah.
Understanding the value of that and being able to find the buyer and all the data assets and all this stuff that comes in between, that's where we think there's value what we can give back to the market.
So that's sell side.
Yep.
What about the buy side? How are they buying? How are they buying this inventory? Are the DSPs integrated? I take it that there's you have publicists and a few other scaled sort of solutions on sort of drugs like sort of stuff you can buy over the counter.
Yep.
But then the specialist agencies who do the pharma stuff. So how do they buy into this ecosystem, and what's the rationale for them to do that?
So currently, they'll be doing it all on IOs manually. So I spoke to one client, and they were doing a pan-European campaign for a pharma company. It wasn't for a drug. It was for a convention. So they still wanted to get to doctors, but it wasn't as highly regulated. And I think they did 60 IOs. With
60 IOs.
60 different publishers across, 20, as many markets as they could find in the EU to deliver by tradition. If you were talking about, a very modest campaign budget, if you were thinking about, what you usually book if you were talking to a MediaCom or something like that. So the event, what those guys see it as, it's all, you can give me that audience and you can scale it across Europe and do it in a compliant way. Suddenly I'm doing one IO with you guys, or I can do it automatically through my DSP of choice, or you can do it through our kind of buying platform, which just gives them a front end to log into.
But is the EU obviously makes it easier for you to kind of scale that in the European market? Or are the laws different in each of the countries?
The laws, broadly speaking, they're quite similar in that you can't target pharmaceuticals to consumers. In most countries, you can target them to doctors. There's subtleties about what you can do, and a big project we're working on at the moment is kind of an easy to read or a chart that we can share with our agency and brands that will say these are the markets you can work in and this is what you have to be aware of within those markets. But broadly speaking, you can scale across Europe or the major countries.
How big is this market then? I mean, the pharma space and must be fairly significant in Europe.
Yeah, pretty big. I was looking at some figures earlier this week. I think they're estimating healthcare and pharmaceutical, which is separate to health and beauty, is worth about 460 million this year.
In Europe?
Just in the UK.
Oh, in the UK.
Just in the UK, yeah. And when you think you've got Germany and France, they're probably going to be a similar size, and then Italy and Spain.
Well, that's a combination of like flu remedies and
yeah.
Stuff like
that. So that's your traditional over the counter and your pharmaceutical stuff.
Right.
And we think there's definite gains to be had in both sides.
Right.
The low hanging fruit for us at the moment is the pharmaceutical side because it's so heavily regulated.
Yeah.
There's more problems to solve.
Yeah.
But as we build, get these audiences, get data partnerships, we'll be able to do cleverer things on the over the counter side as well.
So then the publishers you work with are going to use your SSP solution. Now, do you have like a audience segmentation piece as well for them, or how are you going to build that out?
So we're going to have the core piece of technology we have at the moment is we've got our contextual engine, which we've had since our contract days before we came PulsePoint, and we've actually coded that out to build. And this isn't keywords; this is actual segments comprised of several different keywords. We've coded that out to have 27,000 conditions and diseases in it, so we can recognize content across, this gated stuff or the open web to find out, if someone's got a migraine or they've got allergies and things like that. So we're able to go across endemic sites, non-endemic, and just the general web. A lot of newspapers all have content around health and stuff like that. So we built that out, and we're working with lots of different data providers around HCP data. In the US, you can't really do it in Europe, unfortunately, but you can get lots of patient and payer data because they have the payer, which is your insurance company, the provider, which is probably the hospital, and then the practitioner and the patient. A lot of that data is widely available, so you can actually do some quite clever targeting in the US. Over here, we're looking at doing more simpler stuff because that's the nature of the beast, but the simpler stuff hopefully gets us to market quicker.
And do you think the ability to scale, the fact that you'll be able to make it easier for people to buy, will grow that market? I mean, will pharma companies go, well, I don't have to get my agent to sign 17 different IOs, I can actually buy it in one go? So actually making that easier to buy, will that grow that market, do you think?
I think so. I mean, if you look at ad spend in general, it's creeping up. Some years it's a bit flatter. You've got what's happened with P&G recently, but overall, the long term is getting higher and higher. Digital, although it's starting to plateau, is still, I think the IAB stuck out their figures is like 13.8 for H1 year over year. So it's still growing, and then programmatic's about half of that and going up. So we certainly think what we'll do is we'll be able to make the budget they have now more efficient and work harder for them. And the hope is by doing that, we'll grow it as well because we can get more return for them. So hopefully.
When are you rolling this out? Is it rolled out already? Or
it's rolled out already. So we've been live in the US with our kind of health team. Have been out doing deals for a year plus, and we've kind of soft launched over here in Europe. We're talking to several publishers, a couple of data providers and some agencies, and we're just starting to put our first RFPs together now.
Okay. So the appetite's there for it.
Yeah, 100%.
Okay, and do you think this is sort of a part of a greater trend that there's going to be a lot more verticalization in the programmatic space? And I mean, we talked about the generalists, the middle ground, the AppNexts and the Googles of the world, and the Rubicons of the world. They kind of cover all the bases. But do you think there will be companies that kind of verticalize in the programmatic space? So maybe not obviously the kids market, which is super awesome, and then maybe auto and all those different sort of verticals. Is there opportunity there?
I definitely think so. And I think almost led by the publishers as well. With GDPR come in and the implications around how you can use data and the value of an audience you own. I think as the publishers begin to think, well, it's not about necessarily how big I can be, but how deep I can go with my audience. There's going to be opportunities for people to help them realise that, both in the programmatic space, but in general, in digital in general. So I think, you'll start to see more of businesses like us and Super Awesome pop up. Yeah.
All right, Gareth, thanks for that overview of the programmatic health space in Europe and the US, and good luck with the new pivot.
My pleasure.
And that was Trailer Talk TV, and we will see you next time.